Today, we're diving into the science of opioids. Now, this is a group of substances that can be both a life saving medicine and, let's be honest, an incredibly serious danger. And knowing exactly how they work, that's really the first step in making smart, safe choices for yourself and everyone around you.
So that's the big question, right? How can one single thing be both a helpful medicine and a dangerous drug? Well, the answer isn't simple, but it all starts with understanding what opioids are and, more importantly, what they do to our brains. Okay, first things first, let's get the words right, because you'll hear both of these. Opiates are the natural version, coming straight from the poppy plant. Think morphine or codeine. Opioids, that's the bigger umbrella term. It includes the natural stuff plus all these synthetic or lab-made versions. So just remember, all opiates are opioids, but not all opioids are natural.
So, when are they actually used as medicine? Well, when they're used correctly, under a doctor's supervision, prescription opioids have one really critical job: to manage severe short term pain. We're talking about the kind of pain you'd have after a major surgery or a really serious injury. In those cases, they can be a super important tool for healing.
But, and this is a huge but, there's a massive flip side. The risk of misuse and addiction is so incredibly high that these are some of the most carefully controlled medications out there. And that risk, it isn't an accident. It's built right into the way they work with our brains, which we're going to get into in just a minute. All right, to really get our heads around the risks, we need to break opioids down into three main categories. And knowing the difference between these is absolutely key.
So, what are they? First, you've got your prescription opioids, which are legal meds from a doctor. Second, you have heroin, which is a well known illegal opioid. And finally, there's fentanyl, a really powerful synthetic that shows up in both legal medical forms and extremely dangerous illegal ones.
First up, prescription opioids. You've probably heard of some of these, like oxycodone or morphine. Now, while these are legal medicines that doctors prescribe for pain, there is one critical, non-negotiable rule. They are only for the person whose name is on that bottle. Sharing them isn't just illegal, it is incredibly dangerous.
The second category is heroin. And this one is simple: it's an illegal opioid and it has absolutely no accepted medical use. Because it's made and sold illegally, you have no idea what's in it, how strong it is, or what it's mixed with. It is never, ever safe.
And that brings us to our third category, fentanyl. To understand its power, you just need to look at this one thing. It can be 50 to, get this, 100 times stronger than morphine. That mind-blowing potency is what makes it useful in a hospital for severe pain, but it's also what makes it exceptionally deadly on the illegal market. This slide really shows the two faces of fentanyl, doesn't it? On one hand, you've got a medical tool used by doctors in totally controlled settings, and on the other, you have an illegal substance, often mixed into other drugs without the person even knowing, where an amount as small as a few grains of salt can literally kill you. So how do these substances actually do what they do inside our brains? Well, we can use a really simple analogy to understand some pretty complex science. Think of it like a lock and a key. This is almost exactly how opioids work. You see, our brains and bodies are covered in millions of these tiny docking stations called receptors. You can think of these as the locks, and they're located in areas that control some of our most vital functions. Things like how we feel pain, our breathing, our emotions, and even our brain's reward system. So what happens when the opioid's key fits into one of these locks and turns it? Three huge things happen. First, pain signals get blocked. That's the medical benefit, right? Second, the brain releases a massive flood of dopamine, which is that feel-good chemical that gives you a rush of pleasure. And third, and this is the really dangerous part, it slows your breathing way, way down. And that leads us right to the heart of the matter. What happens when these powerful substances are misused? We're talking about taking them without a prescription, not following a doctor's orders, or using an illegal form. This is where the danger just skyrockets. Okay, so let's get specific. What are the actual health consequences we're talking about here? The risks really break down into two categories: things that can happen right away and things that build up over time. In the short term, you've got immediate dangers like confusion, extreme sleepiness, and that really dangerous slowed breathing. But over the long term, three major things can happen. One is tolerance, where your body needs more and more to get the same effect. Two is dependence, where your body adapts and feels like it needs the drug just to feel normal. And finally, there's addiction,
a disease where the brain actually changes and creates an uncontrollable craving.
And it's so important to understand this. Addiction is not a choice or a moral failing. It is a physical change in the brain. That huge dopamine rush basically hijacks the brain's whole reward system. The brain's wiring literally changes, and it starts prioritizing the drug above everything else, even basic survival instincts like eating. Okay, so we've covered the science and the risks. Now let's get to what is, without a doubt, the most important part. What does all this mean for you, and how can you use this knowledge to make smart choices and keep yourself safe? Think of these 5 steps as your personal safety plan. The first 2 are all about prescriptions. Never, ever take medicine that isn't yours, and always follow a doctor's instructions to the letter. Number 3 is straightforward. Avoid illegal drugs. They're just too unpredictable. And finally, always feel empowered to ask questions about any medicine, and please talk to an adult you trust if you're ever worried or confused. At the end of the day, all of this information is about one thing: protecting the most complex and valuable thing you will ever own, your brain. It controls everything you think, everything you feel, and everything you do. So, the final question is really for you to think about. Knowing what you know now, how are you going to protect it?